Professor Jason Leitch is to step down next month from his role as Scotland's National Clinical Director. He says he now wants to look for new challenges across health and care. Recently, he ran into controversy when it emerged that he had deleted his WhatsApp messages during the COVID pandemic. Throughout that crisis, he was a key figure in the Scottish Government's response and a familiar face on our television screens.
We have to look at each local authority on its own, and we have to do it over time. And if we can find reasons like outbreaks, that really encourages us, because that would suggest no mass community transmission, which is what we're really worried about. Vaccination is not a selfish act. Vaccination, if you're 22, is not just for you. It's also for your mum, your dad, your pals, your granny. It's for everybody else. There are 3 weapons against this virus, every variant. It's never changed. Human behaviour, vaccination and test and protect.
We discussed Professor Leitch's decision to quit as the National Clinical Director with the health journalist Pennie Taylor. Pennie, what's your reaction to Professor Leitch's resignation?
I personally am very sorry to hear that he's going, and I think that Scotland loses a real champion of healthcare quality improvement. He has achieved really astounding things in his time working alongside the Scottish Government in terms of patient safety. We've seen avoidable deaths in hospitals fall by 10% in the time that a patient safety programme that Professor Leach really drove has been in place. Deaths from sepsis falling in Scotland, again as a result of his work. You know, he's championed public and patient involvement in our healthcare services. So I think he's a loss. We've
heard the phrase he used, I think, along the lines of, you know, going to pursue other things. Yeah. But to what extent has the whole WhatsApp row during the UK COVID inquiry played into this?
I imagine it will have affected him very deeply. You know, he's a man of great principle, and I think that he will have been, I imagine, shocked by the reaction to, for instance, the deleted messages and some of the, as he described them, flippant comments that were made on social media at that time. But he's only 55. He's a man of incredible resources. He has an international reputation built on the work he led in Scotland, so he won't be short of offers for other things to do.
And he became very prominent to the general public during the COVID inquiry. He was central to the government communication.
He really was.
Not inquiry, I beg your pardon, during the actual pandemic.
During the actual pandemic, his communication skills are extraordinary. And, you know, when have you heard somebody representing a government talking like that so directly? And I think people in Scotland really appreciated his frankness, his directness, his honesty about the situation. So I suppose then you see the fallout after the inquiry. You know, the bereaved families, COVID-bereaved families, were appalled by what they heard. And I imagine that as a clinician, that will have affected him quite deeply as well.
And the message changed sometimes during the pandemic, but I suppose that was the nature of it.
It was a shifting, it was 3 incredible years. And I think there was a sense in Scotland that the communication here about what we were facing and what we had to do was very much better, and that owed a great deal to Professor Jason Leitch.
So you think he's getting an international reputation? Yeah. You say he's getting an international reputation. What might Professor Leitch go on to do?
He's a specialist in international healthcare improvement, and as we know, healthcare systems around the world are all struggling. So his serious skills as, you know, he's a dentist by background, he's a clinician, he's a member of Royal Colleges of various surgeons. He's regarded very highly internationally. But according to the statement that he put out today, he's going to actually spend his time concentrating on 2 charities that he supports, and it'll be very interesting to see what he does next, and I wish him well.
What is the actual role and who might replace him?
Well, it's clinical director, kind of right across Scottish Government, and he's been working in in that sort of a role for about 17 years. He started working alongside the Scottish Government around about the time the SNP government came in 2007, when Nicola Sturgeon was Cabinet Secretary for Health. So he's been there for a long time, and he will certainly have inspired a lot of people to think like he does and work like he does. I just really hope it sticks. But there are people that have worked with him for a long time very closely that get what he did, and hopefully they'll pick up the baton and keep going, because it's absolutely essential, especially right now when our health and care systems are on their knees, that there are clever people with good ideas who can deliver them out there working on our behalf.
Pennie, thanks for joining us.